Hello everyone, welcome to this audio podcast. This audio podcast is part of the syndicate. This audio podcast is part of a Boston syndicate. This audio podcast is part of a Storm and Saga analysis. This audio podcast as part of the Squallish additional series, and this audio podcast as part of a Storm Robotics production. Today, looking at in around renal and around polypharmacy, in around renal and polypharmacy, and polypharmacy. Um, to begin with, polypharmacy is in effect is a continuous use of multiple medications or pharmacotherapeutics to treat a single condition or all conditions. The lack of transparency and a universal sort of definition, universal sort of definition or consensus of polypharmacy, for example, in around minor, moderate, and major, makes it challenging for healthcare professionals to best advise and when considering pharmacotherapeutics efficacy and best practices. Multiple pharmacotherapeutics are poorly defined in amongst literature, and there are several sort of bases which can add complexity. Polypharmacy is also associated with adverse outcomes, including mortality, falls, adverse drug reactions or pharmacotherapeutic reactions, and lengths of hospitalization durations, length or duration of hospitalizations. In additionally, the phenomena of multiple pharmacotherapeutics is directly related to the number of comorbidities or multimorbidities. CKD or CKD recipients can be prescribed, for example, various pharmacotherapeutics to prevent or preclude sort of symptomologies of different of in around different comorbidities or in around different comorbidities, but also where pharmacotherapeutics or polypharmacy can help manage some of the attributed comorbidities or multimorbidities. More pharmacotherapeutics tend to be added to control complications in around sort of the sort of metabolic aspects of excuse me, in around the metabolic disorders or conditions, and sort of bone mineral disorders or conditions, anemia, in addition to anemia, and other sort of complexities. Multiple pharmacotherapeutics might also have complex interactions for example, in around sort of nutrients, which can lead or could lead to sort of a sense of compromised basis. An investigation has had shown that CKD recipients, for example, can have higher prevalence of inappropriate pharmacotherapeutic prescriptions, for example, mostly in around, for example, mostly in around in around treatments of antibiotics, and in around antihypertensives, for example. If it often implies if literature or the evidence has implies sort of a negative situation involving unnecessary unnecessary pharmacotherapeutics, and therefore this is and has become a sort of a concern in around terms of healthcare, around terms of healthcare. The most known predictors of for polypharmacy implementation can include age and predominantly around the female gender, poor self-reported health, and low educational and in around and in around aspects pertaining to health literacy or educational status. And as part of this audio podcast, I look at in around sort of the I look at sort of some aspects pertaining to sort of vaccinations, and in line to sort of where literature has interlinked sort of aspects pertaining to vaccinations to laboratory practices, but also in line to polypharmacy. So advanced in around hepatitis B, then hepatitis B and HBV vaccination, advanced age, male gender, and previous blood and previous or historical blood transfusions are associated with poor seroconversion rates. Patients with CKD in amongst the literature. Where literature informs that excuse me, literature informs patients with CKD must be immunized, for example, before starting different forms of KRT or RRT, where applicable, and the use of HBV vaccine and preventative measures have helped reduce the incidence of HBV infection in patients in on KRT or RRT. It is important to vaccinate CKD recipients, and a recommended vaccination schedule is 4 doses. For example, in amongst the literature, 4 micrograms of a particular brand, and for the purposes of this audio podcast, the brand will not be mentioned, but 40 micrograms of vaccine at 0, 1 and 2 and 6 months, or 3 doses of 20 micrograms of the particular brand of vaccination at 0, 1 and 6 months. And now looking at sort of varicella vaccination. So varicella is a common benign infectious disease or condition and predominantly in amongst the pediatric or young population, but it may be severe and even fatal in immunocompromised children or young people. Furthermore, zoster condition, a form of varicella, usually occurs in adult and elderly population. Response to varicella vaccination has tested well in KRT or RRT recipients, and it was generally have been evidenced as tolerated and protective. Varicella infection was frequent and serious amongst non-immunized post-transplanted or solid organ transplanted recipients. For recipients older than 12 years, available guidelines had recommended 2 doses of 0.5 ml with no booster doses. As part of influenza vaccination. Influenza is generally a common infection that is responsible for many has been responsible for many deaths because of the virulence and the pathogenic power of this virus. influenza vaccination is and has been recommended in CKD in the CKD population. The risk of hospitalization of death is decreased in vaccinated KRT or RRT recipients compared with non-vaccinated recipients, and investigations have informed that influenza vaccination is safe and effective in recipients with CKD despite an impaired antibody response. Vaccination against influenza is also associated with decreases in mortality, and analysis informs a decrease in hospitalizations. Antibody titers can be lower than in healthy populations. However, satisfactory protective rates can be reached by annual vaccination. The correction of vitamin D deficiency, additionally among KRT or RT recipients can additionally improve the immune response. A single dose in amongst the literature informs or highlights a single dose of 50 micrograms has demonstrated decent efficacy in amongst the CKD population. In amongst now looking at Streptococcus aureus vaccination. So S. aureus is a major cause of nosocomial and community acquired infections. Patients undergoing KRT or RT represent a risk cohort of developing infection to S. aureus due to the violation of the skin barrier. ESRD recipients may have an impaired immunological response with a 50% reduction of IgG levels 6 months after or post a 25 microgram vaccination. Renal recipients reach protective antibody levels only for about six months. There is no sort of recommendations or overall consensus for the use of Staphylococcus aureus or S. aureus. In around a pneumococcal vaccine, the burden of pneumococcal infections in CKD recipients is high. The cost of pneumococcal vaccination is generally low. Pneumococcal vaccination should be administered or prescribed to all CKD recipients as early in the condition as possible. CKD recipients over the age of 19 years should receive a dose of pneumococcal conjugate vaccine first, and followed by a dose of pneumococcal polysaccharide vaccine at least 8 weeks later. The dose of pneumococcal polysaccharide vaccine is recommended 5 years after the dose for persons ages 19 to 64 years. And then finally, looking at adjuvant therapy. So another way to improve the immunological response of vaccines in ESKD or ESRD recipients is to use an adjuvant therapy or pharmacotherapeutic to vaccination in order to stimulate the immune system. One of the most important investigations relating or regarding adjuvant drugs was and have been where adjuvant pharmacotherapeutics were used with a granulocyte macrophage colony stimulating factor or GM-CSF. This can help the proliferation and maturation of cells into granulocytes and macrophages. So that draws this audio podcast to a close. This audio podcast, as part of the The Syndicate, this audio podcast is part of a Bostic Syndicate. This audio podcast is part of a Stallman Saga Analysis. This audio podcast is part of the series The Squallish, and this audio podcast is part of a Storm Robotics production.